And that even makes you wonder what will happen when they implement the health care debacle. What will happen to the kids that are born with deformities and Down syndrome, and the way the Democrats are coming off with this have to have a perfect race here starts to sound a little bit like Hitler.
We won't get into that, but we'll get into the issue of government making decisions, and that's, I think, our biggest concern when you have the example of Social Security. All of us feel very confident about that and its stability. You know, it's in deficit right now. Medicaid, we're cutting back, and we're throwing that on the states as a mandate without payment. Medicare is broke. Medicare Advantage is the only part of it that has worked, but again, that's because the Advantage portion is a choice, private sector portion. And then those of you that have used Veterans Administration, I mean, if you think that's the example, and I'm not talking about the individual doctor that gives the care, I'm talking about the lines, I'm talking about where they keep the records, how many times they're lost in St. Louis and you need them here in Michigan. The Veterans Administration system is not the sample I think we want for our health care as well. So.
Tim, my understanding is that like Social Security program and Medicare, Medicaid were pooled programs that basically build up a pool of money to be distributed to people that need it, when they need it. And my understanding is that the federal government then has seen those large sums of money and tapped into them. And from what I understand of your healthcare bill, it's a pooled bill as well. Is that correct? You build up a pool of money to disperse to people that in need when they need it.
No, that would just be the high-risk pool for that limited number of people who truly cannot get insurance.
Sure.
Because of a pre-existing condition that says it's going to be costly, and if you want it, you're going to have to pay well beyond that $7,000 or $10,000 per household or whatever it is to get insurance.
My concern is how do you write legislation that protects that pool, because that pool is going to get to the point where it's going to catch the eye of the federal government and they're going to tap into that. How do you protect that?
Yeah, I mean that is always a challenge with it. I think the best example of what we've done with it is the state insurance pool. That goes up and down depending on usage and need. But for the most part, we have high-risk drivers who are able to buy into a pool at a reduced cost. They still have to buy into it. But it's based upon a subsidy because we mandate insurance. Now, there's always a choice for a citizen under my plan. If you don't want it, then don't get it. But it does also take care of those who go in that now are going to the high-risk pool that's called the emergency room. That's the most expensive and costly medical care that we can possibly have. No, there is no bill that would be perfect, and it will always mandate oversight. But we're not talking about the dollars that is in the Social Security system that's been abused by, able to be abused by government. You know, there may also be other ideas that come up to deal with a high-risk situation, but they'll be limited, as opposed to saying we're going to mandate coverage on everybody, and it's all going to be the same.
No, I don't have any problem. I don't have any problem with building a pool as long as it's protected and spent the way it was meant to be spent and not tapped into for whatever reason.
Price of liberty is eternal vigilance, and you can build a fence as high as you want, but if we're not watching our government, it's always tempting.